with Balanced Wellness. I am excited to interview Dr. Shawn Tassone today. He will be joining us, and I'm particularly excited to interview him because he is an integrative medicine specialist specializing in women's health. And, you know, with anything women's health related, I'm very excited that we have an integrative medicine specialist because it's very much needed, honestly, in the women's health field. So welcome. Thanks for joining.
Thank you. You know, it's funny because there's a lot of what I would call hormone experts out there. Whether or not they're experts, I don't know, but it's so easy anymore to just say you're an expert in something. But I've been doing hormones, bioidentical hormones and hormone replacement for probably over 15 years. And, you know, it's funny because I did the integrative medicine fellowship at the University of Arizona in 2005. And I really, you know, I had one foot in allopathic medicine, so I do surgery and all this other stuff, but I also do other things, like I'll recommend yarrow flowers for heavy bleeding or something like that. So, you know, just a little bit bipolar, I guess.
Well, you could call it bipolar. I like to think that seems to be the most effective medicine, in my opinion. You know, there isn't a pill and there isn't a surgery for every condition out there. And a lot of times certainly the safest, but also the most effective treatment protocol is going to start with, you know, food therapy or some herbal therapy, like you're mentioning, or, you know, habit changes, lifestyle changes, that kind of stuff. And it seems for a lot of practitioners that it's just kind of straight to the pharmaceuticals for, I mean, sometimes just because that's what they're trained in.
For sure. And when, you know, to defend my colleagues, when you are seeing 40, 45 people a day, sometimes it's hard to, one, know a little bit about everything like that. And then two, to really sit down and spend the time with somebody and talk to them about, you know, diet and stuff. And so even for me, because I still take insurance, it's hard for me I can't block out an hour to talk to somebody. So what I've tried to do is devise a kind of like a cadre of providers that I can refer to. So if I want to do, say, acupuncture, or if I think somebody might benefit from some sort of nutritional therapy, I have people in town that I'll send them to.
Yeah. And I think that's a good way to do it, because it's hard to do all of the things as one provider. So having a good group that you can trust or refer to can be so helpful. So you mentioned that you were in a fellowship in Arizona, and that's where you lived and practiced for a while before moving to Austin?
Yeah, I was in Tucson from 2002 to 2013, and then 2013 moved to Austin.
Okay, so been here for about 7 years, and you relatively recently opened your own practice, though, right?
Yeah, I was in a big group here in town. Kind of got tired of the constraints of being kind of different, as I was called. And just in about 2017, went out on my own. So, you know, obviously being by yourself has its own fun things, as you are aware as a business owner, especially with COVID. But things have kind of come back now, and you know, it's been great because with the COVID kind of opening up telemedicine like it did, I've been able to talk to a lot of women now around the country about hormone imbalances and things like that. So it's been kind of nice to have a bigger reach. And so ideally, obviously, seeing somebody physically once a year here in the office is what the medical board would like, even though I think that's even slightly antiquated for certain things like hormones and stuff like that, but you still got to play by the rules.
So when somebody's coming to you, I mean, I would imagine every so often somebody's coming and saying, I have a hormone imbalance, can you help me? But more often it's likely I have XYZ symptoms, and you say this is a hormone imbalance. So what do people tend to come to you with that you're able to help with?
I mean, obviously, we all hear this. I mean, in any profession, insomnia, fatigue, hair thinning is really common. Weight gain, usually not weight loss, but occasionally. Just kind of that generalized anxiety, irritability, kind of feeling like you want to choke somebody out, even though they don't necessarily need it. Some people need it, but not everybody. But yeah, the big ones, I can't tell you how many times a day I hear hair thinning. That's really, I mean, all the time. And that's kind of increased. Obviously, decreased libido is really common with what I do. Fatigue, especially in the afternoons. But yeah, it's just, and it seems to be obviously now with the way we've been living our lives for the past, 6 months or so, a lot of those complaints are just escalating.
Mm-hmm. Yep. A lot of those complaints are escalating as stress grows and those stress hormones become imbalanced, and they affect the sex hormones as they're all kind of playing in the same sandbox, so to speak. So are you helping people with an integrative approach to help with their stress as well?
Again, I mean, most of the time I might refer out for something like acupuncture, or it depends on the person and how open they are. But occasionally, I might recommend. I have friends that do, Reiki or craniosacral therapies. The great thing about being here in Austin is really just having a pretty wide array of people that you can refer to. I even, somebody who came in the other day who was a lot of her stress was around finances. I have a friend here in town, Christina Wise, who's a really smart lady and does a lot of financial stuff and has a class. And so, I might refer somebody off to that. It's really just kind of being open to the so many different pain points that people have, and understanding, like I said, as a surgeon mentality, trying to not just say, it has to be removed, or it's diseased or whatever, because a lot of the times, and I think that's also how I've learned how to be maybe kinder to myself at times, is that, sometimes, most of the time, like you said earlier, it's about food, it's about stress management. And if you fix those things, usually the what I see in my office is kind of the end result of things versus that being the primary problem.
Right. Yeah, it's a lot easier to be preventative and to try to correct these issues with less extreme measures early on. But if they get to the point where they need surgery, thank goodness for that you're doing what you're doing and that your colleagues are doing what they're doing.
Everything has its place. I mean, when I was in the integrated medicine program in Arizona with Andrew Weil, and he would say, if I'm in a car accident, take me to the emergency room.
Right.
But if I have a cold, I want to see my naturopath. I mean, there's places for everybody.
Yeah, it's funny. I say the same thing. Don't come to me if you're having a heart attack or in a car accident. I'll help you afterward, after your surgery, and we can get you back on your feet. But yeah, there's a place for all of us to play together, I think.
And that's where some of the animosity comes in. I think on both sides, you have the physicians that are fearing the loss of territory, as it were. And then you have a lot of all these alternative medicine practitioners sometimes that maybe overstep their bounds, or make claims that aren't necessarily things they can back up. And so, and it's usually not everybody. You just get some fringe people on both sides, and then it kind of just breaks down. And I just feel like, like we just said, there's a place and a time for everything. I was having a discussion with a couple colleagues the other day about referrals to alternative care practitioners for cancer therapies. And, as long, in my opinion, as people aren't being like bilked out of thousands of dollars or being lied to, the power of the mind to help heal can be amazing. And if they feel comfortable with what they're doing, and who's to say it doesn't add 6 years to their life or whatever. And it's not my place to say what works and doesn't work, even if there's literature, because the N of one, that one person, it could work for.
Right.
And as long as they're not out $100,000 for something that didn't work, I mean, I'm all for trying it, you know?
Yeah, and I think that's the beauty of the integrative medicine approach. It's putting your patient at the center rather than trying to figure out what's going to work for 30,000 people. It's going to be a different answer than what's going to work for this one patient that's in front of me that has this specific family history, that has already tried X, Y, and Z. Let's start with what is probably going to be the most logical, safest, most effective approach
Mhm.
for you, and then we'll kind of go from there. So I love it. So when you're doing hormone replacement therapy as one of the things that you're doing, what are you using? Because I know I had you do a little questionnaire before this that you are pretty opposed to pellets, and
Yeah.
that's what I've heard of mostly. So I'd love to know what you see as the problems with those pellets and how you're going about it.
Well, my method of hormone replacement is usually either topical creams or sublingual tablets, because that kind of feeds into the pellet thing. I mean, the pellets are primarily invented to treat animals. And because we don't really care in animals if their hormone levels go too high, because they either just get more muscular, which is food, or they make more milk, even though it's not good, it's just what they used them for.
Mm,
Over time, what happened was, just as happens in medicine all the time, there was an idea to use pellets. And I think the idea itself was probably well thought out, in the sense that, well, you only have to use them every 3 to 4 months. You can put a lot of different medications in them. And there's some, you don't have to worry about taking them every day. So the thought process was there. The problem is, primarily, it doesn't work. I mean, the levels go way too high. I mean, I can't tell you how many times I see women with testosterone levels in the 300s, which is a man's level, and they take forever to come back down. So a lot of offices now have gone to not only just putting in a testosterone pellet, but then giving you 2 additional medications right off the bat to offset the high testosterone they know you're going to get.
mm,
Um, the other problems, they're every 3 to 4 months. It's not a surgery, but it's a procedure in the office, and it can be painful. It can get infected. Primarily, the cost is probably 5 times what it would be to have a cream that you would apply. If you have side effects from pellets, from the levels being too high, you can't get them out, and you're kind of stuck with them. And they just they're the other thing is, I call it the law of diminishing returns, in the sense that it's like drinking Gatorade. When you drink Gatorade, it quenches your thirst, but they put citric acid in it to make you more thirsty.
mm,
So what happens with a pellet is, your level goes so high that as it starts to come down, and it goes high quickly, so you feel amazing. I won't doubt that. You do feel amazing. But as it starts to drop, even though your testosterone level is still 2 times the normal level, because you've dropped from way up there, you feel horrible. So you're still high, but you feel horrible. So what do? You say, oh, I got to get back in and get my pellets. So you get this sawtooth pattern, but you're never even in the normal range for a woman. And not only is that bad testosterone wise, because you get hair growth and some bad things like voice deepening and things like that, but if you're using estrogen as well, that's obviously high levels of breast exposure to estrogens and other things, blood clots and whatnot. And so the other thing about creams is that if you don't like the levels, you just stop taking them and they go away in 24 hours. So it just seems to me like, I call pellets lazy. Like, it's for people that want to make a lot of money, because they make the providers a lot of money. And I only know this because I looked into it years ago. Your profit margins are higher, but it's also protocol driven. It's not artistic, in the sense that every patient gets the same thing. So you plug in the labs to the company that sells you the product, and they just tell you what to use.
mm.
And so there's no thought process there. And because of that, a lot of the people that put pellets in are just going to a weekend course. There's now plastic surgeons and all these other doctors that have absolutely could care less about hormones, but it's a moneymaker. And so they're bringing in patients, and I only see the other side of this when they come in with all their problems from the
Mm,
pellets.
yeah.
So obviously I'm seeing a biased population, and I'd freely admit that. But I also could be super rich if I put them in, because I see so many women with hormones. I just can't bring myself to put them in. I just don't like them.
Yeah. I mean, it sounds like at the very least, the conversation should be had with the folks that are putting the pellets or considering having pellets put in, just
Yeah,
to, see what
definitely.
the pros and cons are.
And
Um,
that's the other thing. I just don't feel like women are getting the true, like, hey, actually, your hormones are going to go really high. And here are some of the problems you could have.
right.
I think it's more presented like, oh, things are going to be nice and smooth, just like anything else. I just don't think informed consent is probably all that informed.
Yeah. Have you found anything else that you're able to recommend to folks beyond, going the pharmaceutical route, whether it is creams or sublingual, to affect their hormones? Like if somebody wants to be preventative, or maybe they're on the beginning stage of having a hormone imbalance, are there any recommendations that you have for those folks?
So I will recommend a lot of the time. It also depends on what the imbalance is. So, but for a lot of women, one of the first things I like to recommend is maca. I'm a huge fan of maca. The one company that I prefer is Symphony. Used to be called well, they make a product called Feminescence, and the reason I like them is because the problem with a lot of maca that's on the market, like women will buy it as a powder, is that the Chinese came in years and years ago and bought a lot of the maca on the market, and then they cut it with a bunch of other things, so there isn't a whole lot of maca in the product.
Mm,
And so the company that makes Feminescence came in after the Chinese did that, and they bought all the land, so they can't do that anymore. And maca has 13 different phenotypes. So there's red, white, yellow. There's different kinds, and certain types like black maca is better for men, say. And so you want to. And it's really interesting too. Uh, uh, like say white maca grown in this part of Peru versus this part of Peru can even have different qualities. So if you're just using a powder and they don't know what the maca is or what the blend is, because some maca is good for like PCOS or polycystic ovarian syndrome, some is good for menopause, others are good for men. And so you just really want to make sure you're getting the right type. But I find a good maca based product really helps with hormonal balance. And I'm a big fan of obviously a good high dose fish oil supplement and magnesium. Those are kind of the three big things that I think women should be on.
yeah, awesome. Okay. And I also wanted to ask you about, when I was doing a little bit of research and preparation for the interview, I saw that you have a technique named after you.
Well, I mean,
Or did you name it yourself?
well, so there was a coil, a metal coil that was put into fallopian tubes from about 2002 till about 2018. And it was used for sterilization. So we would put these coils in the fallopian tubes, and over time, they would cause an inflammation that would scar the tubes shut. So it was a permanent procedure for sterilization, and it was a vaginal approach. So the thought was, hey, there's no cutting, there's no abdominal surgery, it's safer, blah, blah, blah. Well, the problem is after we put in a million of them, that it was causing some issues for some women with pain, bleeding. We noticed an increase in autoimmune disorders and some other things. And as it does, these things are coated with different chemicals like polyethyl terephthalate, which is an endocrine disrupting agent, and the inflammation doesn't turn off, so it can constantly just be inflamed.
Hmm.
So a lot of women that were coming up that wanted them out were having to have a hysterectomy because that they were scarred into the tube. So I just over time in 800 procedures developed a way to remove the coils and the tubes without removing the uterus. So it's actually kind of that the way that I do it was just kind of named my name because it's just my system. And I find that I now have women come from around the country to have them removed because they don't want to have a hysterectomy. So it just kind of, it wasn't something I ever planned on doing. It just kind of happened over time. I started doing them and women started coming, and I would get and refined the procedure over time. to the point where it is right now.
Yeah. Well, as is the case with most great things in life, you just kind of stumble into them and
Exactly what it was. I literally just stumbled into it, didn't have any plan on doing it, but
yeah.
I'm glad. It's actually, in the 20 or so years I've been in practice, has literally been probably one of those things that has been the most emotionally and psychologically, professionally fulfilling, just because of the changes. Like, I've seen women that had a lady a couple months ago, had a whole body rash for 3 years, seen 6 dermatologists, biopsies and medications, took the coils out, and 2 weeks later the rash was gone.
Wow.
And so that's not a study. That's what we were talking about, this N of one.
Right.
My partners would call me crazy, but I can't discount that. I can't say, and it has nickel in it. So maybe this lady has a nickel allergy that we didn't check. I mean, obviously, a lot of people have nickel allergies. And the fact that it went away right after I did the surgery, and it's like, so not coincidental, I don't think, but so many stories, like a woman who was on rheumatoid arthritis medications. She was on 5 medications at one time, took the coils out, and she went down to 1. So, I mean, definitely, put 2 and 2 together, and that's what I got.
Yeah. I mean, we know at this point that this chronic inflammation is the cause of so many of these chronic diseases and autoimmune conditions. So it makes sense if there's something that is inflammatory just constantly over years and years and years, it's going to have some downstream effects.
So it just brings me a lot of satisfaction to know that when I see these ladies post-operatively, that they're just so thankful, because by the time some of them get to see me, now I've done a lot of YouTube videos, so people find me. But before, it was kind of like they'd ask 3 or 4 doctors and nobody would take them out or help them. They would kind of say it's in your head, and then they get them out and they feel like a completely different person. And I just got tired of my partners kind of saying to me that I was confusing people and I was preying on vulnerable patients. And it's weird how, it's funny, and that saying where in the beginning, a new idea is crazy, and then over time it kind of becomes the standard of care.
Right.
Because I can remember 10 years ago when I was the crazy person for prescribing bioidentical hormones. And now most GYNs will do it,
Right.
because they're made by pharmaceutical companies now. But it's just, it's funny how it's like you're this heretic, and then, hopefully before I die, I'll be like, maybe it'll be like, oh, maybe he was right. But the company that makes these coils is settling a class action lawsuit here. Well, they're settling out of court, so there's no, blame being associated with it. But, things have changed in the last 5 years. We should, so something's there. But like I said, if you have a foreign device and you put it in a person's body, you have to expect that some people are going to have a problem with it.
Yep.
That's what I've always said. I don't think that every woman that ever had these put in has a problem. Probably 25, 30% maybe have issues, but we're not recognizing that. That's where I had the problem.
Yeah. Yeah, that makes sense, because it's if it's causing these major issues for a lot of these women, then it doesn't matter if it's 1 in 1,000. It's still a major issue for them, and needs to be taken care of. And that's great that you're able to do that without doing the full hysterectomy too, because that would just cause so many more hormone issues than are necessary.
Especially for girls that are in their 20s, you know what I mean?
Oh, wow. Yeah.
I have a lot of patients that had these put in when they were 25, and they're 28 now, and they're having all these problems. And even though they had their tubes tied because they might have 3 kids, they're not ready to remove their uterus. I mean, obviously, you don't know what's going to happen 10 years from now, and maybe you'll have a different partner, or your kids are all grown up and you want another child, and you can still have IVF, or do something different. So to take out a uterus is just, that's closing the door forever. And for a lady that's 49, that's totally different than somebody that's 29.
Mm-hmm. Yeah. Yeah, absolutely. So the other thing that I wanted to ask you about was this hormone quiz that you have on your site. Will you tell me about that?
So over 20 years, what I noticed was if I talked to women about, say, estrogen dominance, like you have too much estrogen in your body, and that's why you're having all these symptoms. what I noticed was kind of common themes. Like I would hear stories. A lot of medicine is just listening to the story, right?
Mm-hmm.
And so I kind of picked up on stories. And as I started listening, I noticed there were 12 that I had come up with, 12 different storylines that pertain to different hormone imbalances. So, like let's say estrogen dominance, like I was talking about, I called those women, their archetype is called the queen. And because estrogen is obviously the female, the consummate female hormone, and it's in overdrive, which is a queen. You know, you've got that feminine energy. And so, what I have with the quiz is it's not just your typical like 5-question quiz and tells you what your answer is. It's about 36 questions. They're all weighted. They're specific to each thing. And what happens is at the end, just based on how you answer the questions, obviously it's not labs, but it's just based on how you answer the questions, it will give you which of those 12 storylines you are, or hormonal archetypes. And then each of those archetypes has its own 6-step process on how to correct the imbalance based on spiritual practices, hormonal modulation, energetic aspects like acupuncture or essential oils. There's nutrition recommendations, exercise recommendations, and supplement recommendations.
Wow, that's great. I mean, that's awesome that you can find that out for folks just through a quiz. And that's
Well, it's funny, you know, it's interesting because I've had 20,000 women take the quiz so far, and I had a lady email me a few months back, and she said, "Oh, I just want to let you know your quiz is wrong." And I was like, "Well, it's a quiz. It's
right.
hormone." And she said, "Because I'm hypothyroid, and the quiz told me I'm hyperthyroid." And I said, "Well, like I said, it's a quiz. It's not 100%." And she said, I said, "Well, when did you have your labs drawn?" And she said, "Oh, it was like 6 months ago." She emailed me back like 2 weeks later and said, "Oh, just so you know, I was taking too much thyroid medication, and your quiz was actually right. I was hyperthyroid." But the thing that's the great thing too about it is that because I've done this and I've done it with so many women, in spring of this coming year, HarperCollins is publishing the book that's called The Hormone Balance Bible, which is all about the 12 hormone archetypes.
Oh, nice. Yeah. I mean, it makes perfect sense that when we weren't able to, we still had medicine even when we weren't doing blood tests and urine tests and everything. And it was all based on, patterns of symptoms. It's what traditional Chinese medicine is all based on.
And the thing about it is too, it's not, like I said, it's 20% of the recommendations I give in the book, you need a doctor for. The other 80% you do on your own, self-care.
Yeah. That's great. I think that's what a lot of people are looking for. They want to be able to help themselves. They just don't really know which way to turn. And unfortunately, a lot of the docs that they're going to are not trained in some of the more integrative approaches. So,
and it's just, for those physicians, I think it's, I have a lot of friends that are straight, just, that's what they do. And there's absolutely nothing wrong with that. But what I feel is happening is that so many people are just wanting the doctors to just know more. It's like, not that you have to do the functional medicine training or whatever, but just know a little bit more about it, or be open to the fact that, like today, I told a lady who had a recurrent vaginal infection that she could use tea tree oil suppositories rather than, metronidazole. Just being open to the fact that there are other things that work. And sometimes doctors figure it out after they get sick and they don't want to try traditional stuff.
right.
But it, you can't think that Chinese medicine, which has been around for 2,000 years, is completely erroneous.
Right.
There has to be something to it, or it wouldn't have lasted as long as it has. And general medicine is only a couple hundred years old, So obviously, there's something to that. And a lot of our medicines come from plants. We just super extract them and make them stronger. But yeah, I mean, we just need to, and I wish we could all just speak the same language. I call it, my friend Larry Dossey coined it, but it's the beef stroganoff principle. I think sometimes we're talking about beef stroganoff and other people are talking about beef with noodles, but it's kind of the same thing, you know? We're just saying it different. And if we could just speak the same language, I think it would be a lot better.
Yeah, yeah, that's been an important thing for me. I mean, going through school, going through acupuncture school, we learn all about the Chinese terms, the traditional Chinese terms for describing this medicine, which is great, and it helps you conceptualize how the medicine was created and how we view the body and its connection to nature. But if I'm talking to somebody about yin deficiency or spleen chi, they're going to be like, that makes no sense to me. So I'm happy that there's this growing push within just our profession to understand how this is affecting, you know, nervous system, how the nervous system is functioning and how your endocrine system is functioning. So I think that's helpful so that we can have a more productive conversation between practitioners. Yeah.
Great.
Well, I think I've taken enough of your time here. I appreciate you doing this with me. It's always fun for me to interview other practitioners in the area, to get to know other folks, and I think for people watching, it's important too. So before we go though, how can people find out more about you?
Like I said earlier, I take most insurance plans. So anybody that, you know, annual exams to fibroids, endometriosis, hormone balance. My office phone is 512-956-0296. You can also take the quiz if you want to just dip your toe in the water. It's Tassone, Tassone MD.com /quiz.
Awesome. Well, thank you again, Dr. Tassone. I appreciate you being on with me, and I'll look forward to talking to you soon.